Hello again, I'm Danny at Newman. Today I'm here to show you how to safely inject Mounjaro, a medication that helps with weight management. Mounjaro is a prescription medication that contains tirzepatide. Tirzepatide works by mimicking two natural hormones, GIP and GLP-1. It slows digestion so you feel fuller for longer. This means you eat less and have fewer cravings, which can lead to more effective weight loss. The medication comes in the form of a pen, which you inject weekly. It contains 4 doses, meaning that each pen will last you for a month. Now, let me show you the pen and how to use it. The pen will come with some needles and some alcohol wipes, and a sharp spin to dispose of your used needles afterwards. Step 1. Wash your hands with soap and water and prepare a clean surface for the pen. Step 2. Remove the pen cap and keep it to one side. Check the expiry date. Check the dose strength and the colour of the medication. It should be colourless to slightly yellow and should not be frozen or cloudy. Step 3. Wipe the inner seal of the pen with one of the wipes. Next, you'll need to attach a new needle. Remove the paper tab from the needle and then attach it to the pen. Step 4. Before you use the pen for the first time, you need to prime it. To do this, remove the outer cap followed by the smaller inner cap. The dose selector is at the other end of the pen. Turn the dose selector until you hear 2 clicks and you see the extended line in the dose window. This is the prime position. With the needle pointing upwards, tap the cartridge holder gently to collect air bubbles at the top. Release some medicine into the air by pressing the dose selector until it stops. Keep it pressed while you count to 5. The 0 icon will be shown in the dose window. Priming removes air from the cartridge and makes sure your pen is working properly. Your pen has been primed if a small amount of medicine comes out the tip of the needle. There is always slightly more medication in the pen than is needed, so that you can prime before every dose. Step 5. Choose your injection site. You can inject into the front of your upper thigh, your abdomen, or the upper arm. Clean the chosen area with an alcohol wipe and let it dry. Remember to mix up your injection sites each time to avoid any soreness or bruising. Step 6. Each pen will administer a specific dose. Check that the dose on your pen label matches the dose that you've been prescribed. This pen will administer 2.5 milligrams. Turn the dose selector until it stops and the 1 icon is shown in the dose window. This will administer the dose shown on your pen label. Pinch the cleaned area of skin gently and insert the needle at a 90-degree angle. Press and hold down the dose selector until it stops and count to 5 while holding the dose selector. The 0 icon should be visible in the dose window before removing the needle from the skin. If you don't see the 0 icon in the window, you have not completely administered the dose. In this case, just insert the needle back into your skin and finish your injection by pressing down the dose selector. You should not redial the dose. Step 7. Put both caps back on the needle and unscrew it from the pen. Dispose of the needle in the sharps container. It's important that you don't put this in your normal household waste bin. Recap the pen and store it in a dry place away from direct sunlight. Don't worry if you're not able to refrigerate the pen. Just make sure that it isn't kept anywhere that exceeds 30 degrees Celsius. Remember to always follow your clinician's instructions and never share your pen with anyone else. To get the most out of your program, head on to the Newman app, where you can chat to your coaching clinician and dive into our expert content and tools, allowing you to track your weight, get meal inspiration, and manage side effects and more. Thanks for watching. See you next time.